Hello and welcome to Đồng Nai Radio and Television Station. The Ministry of Health has just drafted a plan to cope with COVID-19 pandemic situation in the period of 2022 to 2023 to submit to the members of National Steering Committee for Disease Prevention and Control and the People's Committee of 63 provinces, cities and related units. Scenario 1. The virus strain continues to evolve. However, because the community has the immunity, the number of severe cases and deaths gradually decreases, leading to the outbreak not being as serious as before or the emergence of new strain of the virus SARS-CoV-2 but less severe. Scenario 2. The emergence of new strain of SARS-CoV-2 virus that has potential to reduce vaccine effectiveness or immunity, causing an increase in cases of severe symptoms or death, especially in vulnerable groups. In this case, the response plan proposed by the Ministry is to flexibly implement the principle of prevention, detection, isolation, joining, stamping out the pandemic, according to the narrowest possible scale and scope depending on the pandemic's development. Flexibly apply anti-pandemic formula combining 5K policy with vaccines and drugs, ensuring treatment effectiveness, applying pandemic prevention technology, raising people's awareness and other measures. On May the 4th, Xuân Lộc District People's Committee coordinated with Sonadesi Long Binh Joint Stock Company and donor Standard Vietnam Shoes Company to hold the inauguration ceremony of a green park, a welcome gate, and an industrial park in Xuân Lộc District. According to the representative of Vietnam Social Security, up to now, the insurance agency has linked the database of 40 million health insurance participants to the national database on population of the Ministry of Public Security. This initial result of piloting the use of chip-based citizen identification cards in health insurance coverage. With this data synchronization, 40 million people participating in health insurance can use their citizen ID or chip ID when going for medical examination or treatment. Also, from March the 1st, more than 12,000 medical examination and treatment facilities have been updated their software to accept citizen identification cards for medical examination and treatment. On May the 4th, the U.S. Federal Reserve (FED) increased the base interest rate to twice of the normal rate to battle high inflation. The total investment in the construction of the project is worth more than 12 billion VND. The land area is wide 7,700 square meters, of which the construction area is more than 249 square meters. Xuân Lộc Industrial Park project was formed on the idea of Chua Chan Mountain. Putting into use the park has contributed to building a green environment, clean and beautiful architectural space in accordance with the district development planning and orientation. At the same time, it helps to develop and expand public living space to meet the needs of cultural activities, exercise, sports, entertainment and recreation of workers and all classes of people in the area. Xuân Lộc Industrial Park, under the management of Sonadesi Long Binh Joint Stock Company, has been in operation since 2006. Up to now, there are more than 32,000 workers and employees working in the companies and in enterprises in the industrial park. European Union Commissioner in charge of Health and Food Safety, Stella Kyriakides, on May the 4th said that the COVID-19 pandemic has entered a new phase, but not the end stage. Accordingly, the FED announced that it would raise the benchmark rate to 0.5%, the highest rate increase in May 2000. And the Federal Open Market Committee raised interest rates by 0.5% to a target range of 0.75 to 1%. The U.S. Central Bank has not raised interest rates by more than 2.25% since May 2000. After leaving interest rate near zero in 2021, Fed Chairman Jerome Powell and other bankers have pledged to quickly bring borrowing costs back to levels that won't stimulate the economy. While the FED is aiming to slow the economy enough to bring down inflation without stopping growth altogether, many economists fear the central bank would be able to prevent price increases without triggering a recession. Ms. Kyriakides recommended that member countries should not be complacent and warned that there is always a risk of a new outbreak. Currently, the World Health Organization (WHO) is paying attention to the supply of the Omicron variant and is concerned about the possibility of a new outbreak of the disease. According to Kyriakides, the EC is concerned that 90 million people in EU countries have not been vaccinated, and many people are hesitant to get booster shots. She believes that these people can become a contributing factor in causing a new wave of pandemic. That's all we have for today. Thanks for watching and see you next time.